The following instructional video will show you the preferred method of taking routine skin smears for the purpose of ruling out and managing Hansen's disease. Routine skin smears are taken from 6 sites, including both earlobes, both elbows, and both knees. Smears may also be requested from typical lesions on other parts of the body. If necessary, additional smears will be requested by the treating physician. The materials required for a set of routine skin smears include gloves, 6 individually sealed sterile single-edge razor blades or sterile scalpels, sharps container for disposal of the blades, 2 slides, laboratory-grade solvent-resistant marker, or any pencil to label the slides, cotton balls to apply pressure to each site after the sample is taken, Band-Aids, alcohol preps, and a slide mailer. Skin smears can produce anxiety for some patients, so it may be helpful to take the first smear from the knee, followed by the elbow, and finally the earlobe. Staying away from the face with the blade for the first few samples gives the patient a chance to become comfortable with the procedure and know what to expect. Starting with the knee, have the patient sit in a chair with the knee bent to 90 degrees and the foot flat on the floor. This position will stabilize the knee and prevent movement. Clean the site with a 70% alcohol prep, starting with the center and working out. Allow the area to air dry. If you are starting with the knee, pinch the skin near the bottom of the kneecap, attempting to make the area relatively avascular. Mild pressure is maintained throughout the procedure to maintain avascularity until an adequate smear is obtained. Using the edge of the blade, make a 3 to 5 millimeter long incision approximately 2 to 3 millimeters deep. After the incision is made, maintain the pinch, and with the blade held at a right angle to the incision, lightly drag the edge of the blade across the incision to obtain the sample fluid that accumulates at the surface. Transfer the sample by tapping the edge of the blade containing the fluid to the glass. Using a circular motion, smear the fluid over the slide, creating an area no larger than a pencil eraser. Using a cotton ball, apply pressure to the skin over the smear site to stop the bleeding. A Band-Aid is generally sufficient to use as a protective dressing. Repeat this procedure for the elbows. With the patient sitting, rest the patient's hand on the leg and rotate the arm so the elbow is pointing away from the body. Finally, the earlobes. Pinch the base of the earlobe, leaving enough room at the tip to obtain the sample. The 2 slides on the left represent a smear that is too large and can be difficult to interpret under the microscope. Also, each slide only contains 1 sample. Preferably, the 2 slides on the right have smears that are more uniform and are of the proper size. This makes interpretation of the samples more consistent. In addition, each slide holds all 3 tissue samples from one side of the patient's body. Make sure the location of the sample on the slide corresponds to the label. If you have any questions regarding the procedure or questions pertaining to shipping instructions, please contact the National Hansen's Disease Program's Clinical Laboratory for further information.